So my name is Padraic McCarthy, recently qualified GP working in Kinsale Medical, and I'm also working part-time as the Curriculum Development Fellow with the ICGP. I would have worked in the hospitals. I suppose in general practice, you have a little bit more autonomy over your time and over the way that you can structure your week. And there's a bit more variety to it as well. I think the other nice thing is that, you're not always meeting sick patients. I think in the hospital, the vast majority of your time you're dealing with sick people. General practice, you deal with the community, and you're not always meeting people when they're sick. You meet people when they're well as well. So that can be nice. And then I suppose you get that bit of variety in general practice, whereas in the hospital you tend to be operating within specialties. In general practice, I mean, even this week, you can deal with gynecological issues, medical issues, surgical issues, pediatric issues. So you get a bit of a flavour of everything. So for someone like myself that kind of likes all bits of it, it's nice. It's nice to get that variety. So there's various fellowships that the ICGP facilitate. I'm currently doing a curriculum development fellowship, so I'm going to be working with Dr. Robert Scully in hopefully updating the ICGP curriculum. But there are other ones as well, and they get advertised, I think, around October. And essentially they provide, I suppose, recent graduates from the scheme with an opportunity to spend some time in research or medical education in my case. And it gives you, I suppose, a chance to do something slightly different. So for me, I work 2 days a week in medical practice in Kinsale. And the other 3 days a week then I'm spending my time developing the curriculum and working with Dr. Scully. So it's just something a little bit different and kind of broadens your horizons a little bit, broadens your scope, and hopefully kind of can add to your career and your portfolio. There are multiple different fellowships, and every year there are different ones that are coming on stream. So they will probably be advertised again towards the end of this year, and they provide opportunities for people to get into research, to broaden their skill set in a kind of a supervised manner while still working in clinical general practice as well.